Bismillahirrahmanirrahim. A 25-year-old woman, gravida 1, para 0 at 10 week of gestation, come to the office due to a malodorous vaginal discharge. She is sexually active, has no chronic medical condition, and has no medical allergies. Vital signs are normal. BMI 26, fetal heart tone are 160 per minute. Speculum examination reveals a thin gray discharge that coats the vaginal wall, but no erythema or edema is present on the vaginal wall or the vulva. There is no cervical or adnexal tenderness. A saline wet mount examination revealed numerous epithelial cells coated with bacteria. No white blood cell or motile organism are seen. Which of the following is the best management option for this patient? So first of all, choice A, boric acid vaginal suppository. B, delayed treatment until second trimester. C, oral azithromycin. D, oral metronidazole. E, povidone iodine vaginal douches. F, topical fluconazole. So first of all, we have to see the patient. As I told you that there is always a hint in the question. So first of all, we have to see the hint. So the first hint they give us that on speculum examination reveal a thin gray discharge they coat the vaginal wall. This is the first hint, and the second one is there is no erythema or edema, mean to say that there is no inflammation. The third hint is on a saline wet mount examination reveal numerous epithelial cells coated with bacteria. So these are the three hint. First of all, we have a thin gray discharge. The second one is no inflammation. The third one is epithelial cells coated with bacteria. So these are the 3 points. So based on these three points, we already know that what is the diagnosis of this question. So what is the diagnosis of this question? This is absolutely bacterial vaginosis. So first of all, for the bacterial vaginosis, we have to give the oral metronidazole. So choice D is the correct one. Why the choice D is the correct one? Because oral metronidazole, this patient of white, gray, malodorous vaginal discharge is due to a bacterial vaginosis. And a bacterial vaginosis, a vaginal discharge with an elevated pH, the pH of this discharge will be more than 4.5, and an amine or fishy odor that is accentuated by potassium hydroxide, that is known as positive whiff test. An increased pH allow bacteria to adhere to the vaginal epithelial cell, resulting in clue cell. So the third one is that epithelial cell coated with bacteria. So on microscope we can see the clue cell. The clue cell are the epithelial cell coated with bacteria. And the second option is we have to remember that in bacterial vaginosis there is a fishy odor with no inflammation. No inflammation means there is no erythema or edema. And the third one is the clue cell. So these three are the hint point, and the choice D, oral metronidazole, is for the treatment of this patient. So we can give oral metronidazole 500 mg twice daily. So we can come to the choice A. Why is the choice A incorrect? The choice A is incorrect because boric acid vaginal suppository are used as adjuvant to metronidazole in patient with recurrent bacterial vaginosis. Boric acid vaginal suppository we cannot give alone to the patient with bacterial vaginosis. Choice B state that we can delay the treatment until second trimester. So treatment does not delayed until second trimester. So we have to give in first trimester for the patient with bacterial vaginosis. The third one is option C, stated that we can give the oral azithromycin. No, oral azithromycin we can give is to treat chlamydia trachomatis infection. Choice E is also incorrect. Choice E stated that povidone iodine vaginal douches. So povidone iodine vaginal douches are used as a general antimicrobial cleanser for, for preoperative procedures. And the choice F stated that we can give us topical fluconazole. So we cannot give us a topical fluconazole because this is a bacterial vaginosis, and topical fluconazole is for the treatment of candida vulvovaginitis. So let's revise once again. So this we have this patient, 25-year-old, come to us to the office on speculum examination. We reveal that there is a thin gray discharge and there is no erythema or edema present on the vaginal wall. And saline wet mount examination, we reveal that there is a numerous epithelial cell coated with the bacteria. So as I explained to you, first we have the thin fishy odor, second there is no inflammation, and the third one is epithelial cell coated with bacteria. So this is the clue cell under microscope. So the diagnosis is bacterial vaginosis, and we can give the patient oral metronidazole as come under the brand name Flygel, 500 mg twice daily. Thank you.